Good afternoon. This is Omar Al-Hattab. I am the Regional WASH Advisor in the UNICEF MENA Regional Office. I'm going to be speaking to you today about the WASH program. WASH stands for Water, Sanitation and Hygiene. Just quickly, a snapshot of MENA region. Number of countries are 20. Countries with a humanitarian situation are 9. We have a population as of 2015 of nearly 460 million. Out of those, about 166 million children, and by children I mean children under 17 years of age. And of course, everybody is aware that the socioeconomic conditions in MENA are essentially middle income to high income countries. MENA has been undergoing a very interesting transformation. Historically, the WASH program only existed in 3 countries without going into much details. From 2000 to 2008, we had the repercussions of the Gulf War II, and we had started a large WASH program in Iraq, which was essentially an emergency response program. In the time frame 2006-2010, we had the Lebanon crisis, and again we had to initiate a large emergency WASH program that was then brought to an end by 2010. Clearly post-Arab Spring, which is post-2011, we started our work, taking full force in 2012. We had large-scale emergency operations in Syria, Yemen, and Libya. 2013, the Syrian refugees crisis started to unfold, and that triggered the launching and the starting of large WASH emergency response programs in Jordan, Iraq, and Lebanon. Finally, and while the WASH program in the Iraq country office had started scaling down, we had to scale it up again around 2015 when the IS infiltration started. So these were the key milestones have here. Now the typologies in MENA, they're quite diverse, as you're aware. Many countries are fairly stable development contexts, and we may perhaps call them fragile states. We have emergency contexts, and we do have protracted emergencies. Now in the fairly stable development context, our work is essentially upstream work and piloting of initiatives. Upstream work meaning we support the host governments on upstream policy work, strengthening the enabling environment, which is anywhere between capacity strengthening to development of policies, looking at the regulatory functions and service delivery functions, trying to segregate those, and so forth. There's of course a lot of evidence generation, meaning studies trying to find correlations between specific WASH areas, perhaps epidemiological areas, nutrition, child protection, and so forth. And of course, institutional WASH as deemed relevant, and by institutional WASH, I mean water, sanitation, and hygiene in schools. Everybody's aware this is really lagging behind in many countries, and of course, WASH in health facilities. In emergency context, we do have the emergency WASH response in IDP camps and shelters and host communities. Activities vary between water trucking, distribution of WASH, NFIs, and so forth. Supply-driven response, and this is essentially on convoys that cross lines and cross borders at times. And of course, the supply-driven is only not limited to that, it also extends to supplying of the essential replacement parts, the water and sanitation authorities. And of course, we explore every opportunity to advance the results in a durable manner. However, in the emergency context, the humanitarian development continuum is essentially resilience strengthening. We do it at small scale, cautiously, especially if there's an armed conflict in the area. And of course, WASH responds to health epidemics. In some cases, there's a cholera outbreak or an acute water diarrhea outbreak that we have to respond to. Protracted emergencies, such as the case in some of the countries in MENA. Of course, we have the emergency WASH response in IDP shelters and host communities, supply-driven, similar to the past. However, we do pursue and explore every opportunity to pursue resilience strengthening at large scale. in order to advance the results in a durable and a cost-effective manner. And of course, the WASH response to health epidemics. Whom are we looking for? What is the profile that we're looking for? Most and foremost, what we're doing here is not about a job, it's a mission. We have to have the empathy, we have to have our hearts in the right place, and that is what we are essentially looking for. We need certain academic credentials. Essentially, we're looking at people coming from an engineering background, hydrology, hydrogeology, and similar relevant disciplines. Practical background experience in middle-income countries in this region. This is really, really critical. Practical background experience in emergency WASH response and all of the operations that I've mentioned earlier, and resilience strengthening, and that is essentially infrastructure development. And clearly, we are really looking for Arab speakers. And by that, I end my presentation, and thank you very much for your attention.